Most people believe heart attack risk begins and ends with one number, cholesterol. But here's the truth. Many with normal cholesterol still have heart attacks, while many with high levels never do. So what is being missed? The answer lies beyond that single number, in the early whispers coming from your artery walls themselves. If you care about understanding your body early, please support this channel by subscribing. It helps this education reach others. I truly appreciate your support as we continue this journey together into proactive heart health. Now let's continue. Heart attacks don't start suddenly. They develop quietly over years, long before pain, breathlessness, or an emergency. Your arteries begin to change, they stiffen, inflame, and lose flexibility. Your body tries to adapt silently. The body adapts to these shifts long before the first symptoms appear. Recognition is your best tool for prevention. Cholesterol measures particles in the blood, but heart attacks happen in the artery walls. That is a critical distinction. Cholesterol alone does not measure inflammation, vessel stiffness, or plaque instability. That's the gap most fall into. You can have acceptable cholesterol numbers and still have high-risk arteries. Internal structure matters more than the scale. Your arteries don't scream, they whisper. They communicate through subtle patterns in your daily health. Subtle circulation changes, blood pressure behavior, and recovery speed are all part of your arteries' whisper. These are early risk signals, not late disease. Most people miss them because they aren't explained in standard tests. Why does this matter? Because heart attacks strike people who feel fine and whose tests were considered normal. The warning signs were there, they just weren't explained. Bridging this gap is the goal of this educational series. In this 9-part series, you'll learn the early warning signs beyond cholesterol and how inflammation raises your risk. We will discuss when to act early, calmly, and intelligently. This is about prevention, not fear. Your health is structural. Learning how to listen to your body is the most powerful preventative step you can take for your long-term heart health. Cholesterol is not the whole story. Your arteries speak long before a heart attack happens. You just need to know how to listen. Recognizing these early signs can save your life. Thank you for starting this series with us. Awareness is your best defense. In our next segment, we'll discuss how changes in your exercise endurance reveal early artery issues. We'll see you in part 2. Invest in your structure, and you invest in your future. Stay strong and stay informed. The first warning sign of artery trouble is rarely pain. It's change. Change in how your body responds to effort. Change in recovery, change in tolerance. And most people explain it away. One of the earliest artery whispers is reduced exercise tolerance. Not dramatic, not sudden, just subtle. You may notice you tire faster when walking, hills feel harder than before, or you need more rest than you used to. People assume this is aging. Often it's not. What's really happening? Healthy arteries expand when your body needs more oxygen. Stiff or inflamed arteries do not. When arteries lose flexibility, blood flow can't increase properly, muscles get less oxygen, and fatigue appears earlier. This happens before blockages are severe. That's why it's an early signal. Why this sign is missed? Because it doesn't hurt, it progresses slowly, and it's easy to rationalize. People say, I'm out of shape, I'm getting older, or I just need more rest. But arteries don't age passively. They change in response to inflammation, sugar, stress, and lifestyle. Why cholesterol may still look normal. Early artery dysfunction is functional, not structural. Blood tests may look fine. Scans may look normal. But artery behavior has already shifted. This is the window where prevention works best. Why this matters for heart attack risk. Heart attacks often occur when plaques become unstable. Arteries can't adapt to stress and inflammation peaks. Reduced exercise tolerance reflects loss of resilience. That's risk, long before collapse. What to pay attention to? Ask yourself, do I fatigue faster than a year ago? Do I recover slower after activity? Does effort feel heavier without clear reason? Patterns matter more than absolutes. The body warns before it fails. Not loudly, not urgently, but consistently. Listen to the whispers of your body to protect your heart. Join us next time as we explore more signals of arterial health. Notice the signs. Protect your future. Most people think blood pressure gives a clear answer. High is bad, normal is good. But that's not always true. Numbers can look normal while arteries are under stress. Blood pressure measures force, but not artery flexibility or vessel inflammation. You can maintain normal pressure by forcing blood through stiff arteries. The number looks fine. The number looks fine, but the arteries are working harder than they should. An early whisper. Blood pressure that rises sharply with mild activity. Climbing stairs, walking uphill, or carrying groceries, your pressure spikes quickly, then slowly returns. This suggests arteries that don't adapt well to demand. Healthy arteries expand, stiff arteries resist. This is often missed because doctors measure pressure while you're seated and calm. But dysfunction shows during movement. Resting blood pressure may still be acceptable. Another subtle signal is a wide pulse pressure, the difference between the top and bottom numbers. A widening gap signals loss of elasticity. Loss of elasticity happens quietly with age and inflammation. Why cholesterol may still be okay? Cholesterol doesn't measure vessel stiffness or pressure dynamics. You can have controlled cholesterol and still develop pressure-related damage. This is why heart attacks occur in well-managed patients. Stiff arteries increase shear stress. Stiff arteries destabilize plaques and strain the heart. Over time, this raises the risk of sudden events. The danger isn't just blockage, it's loss of adaptability. Notice patterns, not just numbers. Pay attention to how your body responds to activity and recovery speed. These clues matter more than a single finding. Closing for part 3. Blood pressure can reassure or mislead. When arteries stiffen, numbers don't always tell the truth. Listen to the early whispers. Stay informed and stay proactive about your health. We'll see you in the next part of our series on understanding your heart and arteries. One of the most dangerous drivers of heart attack risk is not pain or pressure. It's silent inflammation. Most people don't realize it's there. It isn't even detected by standard cholesterol tests in many cases. Heart attacks happen because plaques become unstable. Inflammation is what makes those plaques fragile and dangerous. It weakens the protective cap and irritates vessel walls, turning a quiet plaque into a sudden acute emergency. Arteries don't have pain sensors like muscles or joints. Inflammation in your vessel walls doesn't hurt, burn, or ache. It progresses silently for years. That's why heart attacks often feel sudden, even though the process was long-standing. While arteries don't hurt, your body sends clues: feeling run down, slow recovery after exertion, or frequent fatigue. These signals are not specific, but patterns matter. Persistent low-grade fatigue is often a message from your system. Why do standard tests often miss this? Routine labs may show acceptable cholesterol and normal blood pressure. Inflammation can exist inside artery walls without changing these numbers. This is why people with good labs have events. Standard metrics are only part of the story. The environment inside your artery is what truly determines your risk. What drives artery inflammation? The biggest contributors are sugar spikes, insulin resistance, chronic stress, and poor sleep. Cholesterol alone is rarely the main trigger. It is the inflammatory environment that leads to unpredictable arterial issues. Your lifestyle choices and stress levels directly impact your internal inflammatory state and heart attack risk. This changes how we think about risk. Heart attack risk isn't just about buildup, it's about plaque instability. Inflamed arteries are unpredictable. Prevention must focus on calming inflammation, not just lowering standard numbers. Understanding this shift allows us to take proactive steps toward true cardiovascular protection. It is about strategy. What should you pay attention to? Ask yourself, do I recover slower? Do I feel chronically off? Is fatigue frequent? These are whispers, not diagnoses. Tracking these changes provides you with data to discuss with your healthcare team. Being aware of your body's baseline and how it shifts is the foundation of early detection and long-term vitality. Silent inflammation is a powerful accelerator of risk. It often exists long before pain or a formal diagnosis appear. Recognizing these early whispers can change your life. Thank you for continuing this series with us. Awareness is power. Invest in your structure, and you invest in your future. Stay strong and stay informed. We'll see you in part 5. One of the most confusing early signs of diabetes involves body weight, because it doesn't behave the way people expect. Some people gain weight, some people lose weight, and some notice their body shape changing, even when the scale barely moves. All of these can be visible signs of blood sugar problems. Why diabetes affects body weight. Blood sugar and insulin control. How calories are stored. Where fat is deposited. Whether muscle is preserved or broken down. When insulin doesn't work properly, the body struggles to use glucose for energy, so it adapts, often in visible ways. Sign number 5. Unexplained weight gain. Many people notice gradual weight gain despite eating similarly, exercising the same, making healthy choices. This happens because insulin resistance pushes more energy into fat storage, especially around the abdomen. Calories are stored more easily. Fat becomes harder to burn. This weight gain often feels stubborn and resistant to effort. Sign number 6. Fat accumulation around the belly. Even in people who are otherwise slim, this is visceral fat, fat that surrounds internal organs. It is strongly linked to insulin resistance. You can look normal in clothes and still carry excess visceral fat, and that fat actively worsens blood sugar control. Sign number 7, unexplained weight loss. Less commonly, some people lose weight without trying. This can happen when cells can't access glucose and the body breaks down muscle. Despite eating enough, weight drops. This is more concerning and should never be ignored. Why these changes are missed? Because weight changes are often blamed on aging, stress, hormones, lifestyle, but metabolism should be considered. Weight changes alone do not diagnose diabetes, but when combined with skin changes, vision changes, fatigue, they become part of a larger pattern. What to do if you notice these changes? Pay attention to where weight is changing, how quickly it's happening, whether effort makes a difference, and discuss these observations with a professional. Early metabolic changes are often reversible. Your body shape can change long before diagnosis. These changes are not about willpower. They are hormonal signals. Learning to read them can protect your long-term health. Join us as we continue to listen to what your body is saying about metabolic health. Most people think stress and sleep only affect mood, but they affect something far more critical, your arteries. The damage often happens quietly, without pain or obvious warning. Stress triggers hormones like cortisol and adrenaline. When it becomes chronic, blood vessels constrict, inflammation increases, and the artery lining becomes fragile. This happens even if you think you're handling it well. The body still feels it. Early signs include feeling wired but tired, or having tension without a clear cause. These are not personality traits. They are physiological signals. Why does poor sleep damage arteries? Because sleep is when arteries repair and reduce inflammation. When sleep is short or fragmented, blood pressure stays elevated and inflammatory signals remain active. Over time, arteries lose their resilience. A common signal is waking up tired, even after enough hours. It reflects poor sleep quality or stress-driven arousal. Your arteries didn't fully reset overnight. Stress and poor sleep don't act alone. They magnify everything else: cholesterol, blood pressure, and sugar. This raises the risk of sudden events and destabilized plaques. These factors increase clot risk and amplify other problems. It's often ignored because stress and sleep issues feel normal in modern life. But damage accumulates quietly. Notice patterns. Has your sleep become lighter? Does stress linger even during rest? These patterns matter more than an occasional bad night. Closing for part 6. Understanding these patterns is protective. Stress and sleep shape how your arteries behave, day and night. Listen to what your body is telling you. Your vascular health is about more than just numbers. It's about how your life affects your vessels. We'll see you in the next part of our series. Stay informed and stay proactive. Your health depends on understanding these quiet internal signals. Take care of your heart. Some fruits don't cause problems because of sugar. They cause problems because of what they replace. This is one of the most overlooked issues in senior nutrition. Bones do not weaken only from what you eat. They weaken from what you stop eating. Why protein is non-negotiable for aging bones. Bones are not made of calcium alone. They are built on a protein framework. Without enough protein, bone remodeling slows. Calcium can't be properly deposited. Muscle mass declines. You may feel full, but your bones are starving. Fruit number 8, apples. Apples are often recommended for health, and they can be healthy. But apples are. The issue is not the apple, it's the pattern. Fruit number 9, pears. Very low in protein, very low in minerals. When apples are used as breakfast, snacks, or meal replacements, they crowd out foods that bones depend on. Why calcium alone is not enough. Many seniors think, I take calcium so I'm fine. Over time, this contributes to muscle loss, bone thinning, and increased frailty. Fruit-heavy diets are often calcium-focused, but protein-poor. That combination weakens bones over time. Pears are similar to apples. Low protein, low mineral density, easy to eat alone. Some fruits harm bones not by sugar, but by displacement. It means fruit should support meals, not replace them. Fruit should come after protein, not instead of it. Supporting blood flow is important, but it's just as important to know when poor circulation becomes dangerous. Some signs mean the body needs medical attention. When blood flow drops too much, tissues don't get enough oxygen. Over time, that leads to nerve damage, slow healing, and loss of mobility. Act on these signs. Warning sign. 1. Leg pain when walking that stops with rest. If you feel pain, cramping, or tightness in your calves that improves when you stop, listen. This is called claudication and can sign peripheral artery disease. It is not normal aging. It means blood flow is limited during activity. Warning, sign 2. Wounds or sores that heal very slowly. Cuts on your legs or feet that reopen or become infected can indicate poor circulation. Oxygen is needed for healing. When flow is low, healing slows. This should never be ignored. Warning, sign 3, skin color changes. Pay attention to the skin on your legs or feet. Notice if it becomes pale, turns bluish, looks shiny, or appears darker than before. These suggest persistent problems. Warning sign 4. Constant numbness. Constant coldness, numbness, or tingling, especially in one leg more than the other, can signal reduced blood flow. Warning sign 5. Persistent swelling. Swelling that worsens through the day and doesn't improve with elevation requires evaluation. Many seniors dismiss these as arthritis or aging. Waiting too long reduces options. Lifestyle strategies, including the drink we discussed, do not replace diagnosis. If warning signs are present, seek help. Improving blood flow is powerful, but knowing when to act is protective. Early evaluation protects your long-term mobility. Listen to your body. Stay informed and stay strong. We'll see you in the next part of our series on understanding your circulation. By now, one thing should be clear. Heart attacks do not come out of nowhere. They develop through years of quiet changes. Long before pain, diagnosis, or emergencies, your arteries try to warn you, not loudly, but consistently. Early awareness matters. These changes are often functional and reversible. Listening early gives you choices. Late-stage events leave far fewer options. That's why recognizing the multiple whispers of your system is so critical. If you recognize multiple signs, do not panic and do not self-diagnose. Notice patterns and document changes over time. Discuss concerns calmly with a healthcare professional. Mention reduced tolerance, fatigue, and circulation changes. These details matter. Your description of how you feel provides the context that standard snapshots often miss. Why don't normal tests always mean no risk? Because tests are snapshots, but arteries change dynamically. Many early risks don't show on routine labs and don't cause pain. That's why listening to your body is essential. Who should be especially vigilant? Pay close attention if you have a family history, diabetes, or experience chronic stress. But remember, heart disease can affect anyone. Consistent patterns in your endurance and recovery always matter. Being vigilant about your health markers and your daily resilience is your most powerful tool for protection. The most important takeaway? Cholesterol is just one piece of the puzzle. Your arteries tell a much bigger story. They whisper through your endurance, recovery, and circulation. Learning how to listen to these signals changes outcomes. This series has been about empowerment, not fear. Your body always communicates before it breaks down. Understanding those signals allows you to act early, calmly, intelligently, and effectively. Thank you for following along. If this series helped you, please like, subscribe, and share it with someone who may benefit. Early awareness saves lives. Protect your kidneys, and you protect your life. We'll see you in our next educational series.